Thank you for the kind words, and wonderful that so many of you are here. Thank you for the invitation to speak, and it's really great to be in this beautiful country and this beautiful region together with you. Yeah, so I'll talk a little bit about a really fun initiative, the Lipoprotein A International Task Force. And since I'm not the usual presenter at this symposium, maybe also a few words about myself. I'm originally a biochemist and immunologist, and then worked professionally in the healthcare innovation space. I led the health technology and healthcare innovation practice of McKinsey, the consulting company. Yeah, I'm a patient ambassador since I've got elevated lipoprotein A, and therefore here at this symposium I'm both as patient ambassador and a member of this task force. Here are my disclosures, and you know what I find fascinating about lipoprotein A is, on the one hand, 20% of the world's population have elevated lipoprotein A levels, but usually less than 1% of the people know about it, and very few medical professionals know about it, and even fewer health policy workers know about it. So that's why FH Europe Foundation set up and is jointly with other stakeholders doing this international lipoprotein A task force to really combat 4 challenges that we face. On the one hand, this lack of awareness about lipoprotein A as an independent risk factor for cardiovascular disease. On the other hand, secondly, the lack of visibility in the policy area. Thirdly, that we really have an issue in most countries that I'm aware of with medical professionals, since the few lipid experts who know about it are generally not seeing the broad population that is being managed and seen by GPs. And the 4th challenge, really, that there is also then the question, how do we get from medical guidelines, right? Lipoprotein A is mentioned in the 2019 guideline of the ESC. How do we get into real life? How do we look at cost effectiveness, health economics, etc.? But on the other hand, there are opportunities. There is, on the one hand, policy initiatives like now the European Cardiovascular Health Plan is one example. And more than 100 countries are implementing digital health strategies, where then often cardiovascular health is a flagship pillar to address via digital health. So here's the task force and the members, and if you can look here, there are 3 spots here in this task force for members from the Gulf region. So if anyone is interested in thinking about and working on together on lipoprotein A, not isolated, right, but working on lipoprotein A as broader prevention efforts in the cardiovascular health space, you are very welcome. Please, Magda is sitting here, I'm here, and we've got a stall for FH Europe Foundation. Please come and happy to talk. So far, the task force spans from Canada to Australia. So really, what is our vision, right? I think it's threefold. On the one hand, it's getting and making lipoprotein A measurement the norm, right? Getting from the 1% of the people like myself who got measured. I demanded it from my doctor, right? I went there and said, here's a list of the things that I want to have measured, please do it, right? And then he did. But not everyone does that, right? So we want to make LPA measurement the norm. And then we want to, of course, also integrate that into treatment, right? What do you do afterwards? Once that is done, do you do statins, etc.? And of course, the lipoprotein A treatments are in clinical trials. And then we really want to integrate lipoprotein A in the prevention space. Our mission is to do that in partnership with others, right? We don't want to do a vertical lipoprotein A initiative by itself, right? We very much work in partnership with other stakeholders, and we do that, in whole set of principles and values ranging from transparency to complementarity with other ongoing initiatives. I think this is the most important slide that I wanted to present today, and if you have 30 seconds to look at it, that would be the one to remember. But because it really lists what are the things that we are working towards, what are the goals of the International Lipoprotein A Task Force, and there are 6. And one is the awareness topic that was mentioned in previous discussions here within the session. Second one is the cost effectiveness topics that we are actively working on, and there will be a work in this space in 2025. Then the third one is really thinking about how can we integrate lipoprotein A into personalized prevention models, primary prevention, secondary prevention. The fourth one is very close to my heart, with all of those 100 countries implementing digital health strategies, right? How can we use the digital transformation of our health systems to integrate this into how digitally enabled cardiovascular disease management or cardiovascular health management are being done? The fifth topic is about research questions, and we really want to do, I'll share that in a second, we really want to do also patient and citizen-led evidence generation, where we've assembled a set of research questions, which we are happy to share and discuss, but then also do citizen and patient-led evidence generation. And the fifth one is then the sixth one is then a cross-cutting one, really thinking about what is the quality of life of citizens, what is the quality of life of patients in this whole thing, right? And often one unexpected example is if someone gets tested for lipoprotein A, they are elevated, right? What happens, right? In many countries, then you are alone, and then as a patient, you then navigate diagnostics, treatment options, and it's a bit of a wild path that many patients in our organizations have gone through. So we're very much looking towards the quality of life of the patient and citizen in the center as a foundational topic. As I mentioned, since we are very transparent, here are 2 ideas that we are just discussing within the International Task Force. One idea is really doing initiatives, concerted initiatives on country level to bring the detection rate from the current 1% to 20%, 30%, even higher. Right? And we are discussing with different stakeholders, what can we do, right? Do we go via, you know, I'm from Germany, German Bundesliga sports clubs, right? Do we go to football stadiums, or do we get to go to medical universities and get medical students involved, right? How do we actually raise that testing rate from 1% to 20, 30%? And then the second big idea is this patient-led evidence generation that some patient organizations in other fields have actually started doing. With everything ALS in the neurology space in the US, one example, they've got an evidence generation platform with about 9,000 patients on it, and they do patient-led evidence generation. So this is another thing that we are quite excited about and would love to discuss. There are a few major milestones. I think, you know, one milestone was actually yesterday, and I'm not sure how many of you heard it. The Council of the European Union adopted the conclusion for cardiovascular health yesterday, where for the first time lipoprotein A has been mentioned in the policy space, screening has been mentioned, so we are working towards driving the European Cardiovascular Health Plan and driving that in that direction. And then the other topic and the other date for your calendar, there will be the Lipoprotein A Awareness Day and the Lipoprotein A Global Summit in Brussels next year, 24th and 25th of March. So please mark your calendar. And with that, I'd like to close. Thank you for your attention, and yeah, looking forward to discussions with you.